Hi, I'm Dr. Brad Gardner with Simon Eye Associates, and we're here today to actually give you a good idea of what goes on when you come in for an eye exam. We're going to show you what this equipment's for, what the tests we do, what they're for, and hopefully dispel any myths that you might have. Our patient here today is Sean. We're going to be working with her. So let's go ahead and get started. Okay. One of the first things we do when you come in for an eye exam, of course, we take a case history to have a good idea of what your background information is and your health history. First thing we do when you come in, we test your visual acuities. This is how well you see at distance. I want you to go ahead and cover your left eye. I want you to look down there, and can you read this line for me?
PCVLHD.
Good. And go ahead and cover your other eye, and try that line again.
PCVLHD.
Good, and go ahead and take that down, and then with both your eyes, go ahead and read that line.
DCOTVS.
Okay. Sean here is seeing very well, but we're going to start doing some other tests on her to actually assess the health of her eye. Go ahead and dim the lights for me if you can. The first things we do here is actually test the pupils. This is a neurological test just to make sure the pupils in her eyes are reacting properly. I want you to go ahead and look down at the chart down there for me. It's going to be a little bright. Good. All right. And you go ahead and turn the lights back on if you want. You go ahead and look at this light for me here. You're just going to stare right at this light. This is what we call a cover test. What this test allows us to do is see if your eyes are aligned properly. See if one eye's turned out or in. Good. And I want you to follow this light here with your eyes without moving your head. What we're testing here is to see if her eyes are moving properly. It's what we call ocular motility. And as you can see, your eyes are working fine. I want you to cover your left eye for me with your hand. We're testing her peripheral vision. I want you to look at my eye here, and without looking at my hand, how many fingers am I holding up?
2.
Good. In here?
5.
In here?
1.
And how about here?
2.
Good. Cover your other eye. And I want you to look here.
5.
Just
1.
repeat. And look right here.
5.
Here.
2.
And how about here?
5.
Good. All right, you can take your hand down there. All right. Now we have that out of the way, we're going to check her prescription. This is called a phoropter. What it has in here is pretty much every prescription you can think of in a pair of glasses. This is what we use to get you to see a little bit better. Look here. Now what we're going to do, we started out with a prescription here. Before you came in here, you probably had a test done where you looked at a little machine. That's called an autorefraction. Actually, it gives us a good starting point on where your prescription is. Now right now, we're just looking out of her right eye. And I want you to look down there. And can you make out those letters on the chart down there?
Yeah.
Good. All right. I want you to go ahead and read the first 2 letters for me here.
CD.
Now if I put these lenses in, does that make it better or worse?
Worse.
Good. Now when we test your prescription, we do have some objective tests that we can start out with, but behind here is pretty much a subjective test, meaning it requires good responses from you so we get an accurate prescription. Now when I do this, does it make it better or worse?
Worse.
Okay, good. So a little bit better there.
Yeah.
Okay, and if I drop this down here and give you a little bit bigger line, better 1 or 2?
2.
2 here?
Yeah.
Okay. 3 or 4?
3.
Okay. 5, 6.
6.
Good. All right. And pretty much that's the test. It's just a subjective test. We ask for your responses there, and I would do that to her other eye as well. We also test her up close vision here. I want you to look here, and can you read that line for me?
VCKZNEOH.
Can you still see that line there?
No. It's covered.
And can you read that line?
VCKZNEOH.
Good. And how about here?
Yeah.
Good. All right, and that's all there is to actually prescribing you a pair of glasses. What we also do, of course, you come here to see better. We also check the health of your eyes to make sure that everything's healthy. This here is called a slit lamp. Oh, it does have some lenses in there that makes the structure of your eyes look a lot bigger to us, so we can evaluate it better. I want you to put your chin here and forward against there. I want you to look at my ear here. And what we're doing here is actually looking at the front part of our eye, your cornea, which is the clear part of the front of your eye, your lids, the white part of your eye, your iris, and we're able to look at your lens a little bit on the inside. Go ahead and look up for me. And look down. Look to the right. Look to the left. Look at my ear here. Good. Go ahead and sit back. Now I would actually, in a real exam, do that to the other eye as well. Now, one part of the test that, many people are apprehensive about is actually the pressure test. In some offices you go to, you get a little puff of air blown in your eye. What we do here is what we call applanation tonometry. It's actually where we bring this little thing here pretty close to your eye. That requires putting a drop in your eye, which we'll put in right now. Go ahead, tell your head back. We're not actually going to put a drop in your eye right now, but under normal circumstances we would, okay? And you're going to tilt your head forward there. We're not going to put that in there. The tonometry test here is a pressure test. You might know it as a glaucoma test. What it measures is actually the pressure that's pushing out on the inside of your eye, kind of like when you blow up a balloon. We make sure those pressures are normal. I should go ahead and sit in here and put your chin there. Okay? And what we do here is actually just bring this thing here. You're going to see a little blue light. And you're going to look right at this tonometer tip. We're not actually going to come here really close to your eye. But what we do here is bring this little tonometer tip really close to the eye, and we're going to count to 5, and don't blink. 1, 2, 3, 4, 5. And that's it. You don't feel a thing. And of course, like I said, that's one part of the exam that many people are a little bit apprehensive about, but don't worry. It's a pretty easy test. All right. Now what we do is the pressures are fine, and the front of your eye looks pretty healthy. We're going to actually put dilating drops in. We're not going to do that here right now. But what the dilating drops do is actually help us evaluate the inside of the eye. Your pupil, anytime we shine a light in your eyes, constricts. It regulates the amount of light coming in your eye. We actually dilate that muscle, so we have a bigger window to look on the inside of the eye. We check, make sure back there everything's healthy, and make sure that the periphery around there, which we do have a little model here. If you're able to see that, when we look back here on an undilated pupil, pretty much only able to see clearly these areas back here. With a dilated pupil, we're able to see pretty much all the inside of your eye and make sure everything's healthy. Okay. The dilation part, of course, after we put the drops in, takes about 10 minutes for the pupils to dilate. After then, for about 4 to 5 hours, sometimes sooner, sometimes it takes a little bit longer for them to wear off, but up close vision may be a little blurry, distance may be a little hazy, and bright light will bother you a little bit. But you only have to do that once a year. But actually, that's all there is to an eye exam. Hopefully we dispelled any myths and gave you a good idea of what goes on in the exam room. Thank you, Sean, for being the patient today. And that's pretty much it.